with us now is Dr. Jospitre, who's coming in from SoHo MD and from New York City, of course, a company named after a neighborhood in New York City. For those of you who are not from New York City, SoHo stands for south of Houston, and is a wonderful neighborhood. Also located there is Columbia Startup Labs and Metadata, J Labs, and numerous other digital health companies that are taking the world by storm. Jacques, thank you for joining us today.
Oh, thanks for having me on, Stan.
This is it's wonderful to have you join us, and I think the audience is going to be really inspired by your story and certainly about SoHo MD. Tell us a little bit about your journey, and then certainly tell us a little bit about SoHo.
Yeah, totally. Yeah, first with me. So I'm a psychiatrist with a background in both business and software. I did my medical training at the Icahn School of Medicine at Mount Sinai here in New York, and my MBA at the Zicklin School of Business at Baruch College. After completing my training, I worked as a hospital director for 4 years, and then as a clinic medical director for 3 years, before starting SoHo MD a little over 11 years ago. The real drive for creating the company was seeing that there were so many patients who couldn't find great psychiatric care and couldn't afford practitioners in private practice. And so I was working with a friend and colleague from residency, and we decided to start an organization that could give really high quality care while making it affordable for the average person.
That's impressive. And I know that the audience at the symposium today, again, with hundreds of people from around the world, are really on the same page as you are when it comes to finding ways to use digital to improve health equity, and certainly see a broader range of healthcare available to more people, and using digital toward that end. In your case, and in SoHo MD's case, and again, just to give the audience a better idea, this is not a startup. This is not someone who started a company last year and has a few patients. This is a going concern with thousands of patients, and Jacques, you can correct me, we're there maybe tens of thousands of patients around the country. And
Yep.
this is a real business. And so I want to make sure that everyone understands this is something that's been scaled up by him and his partner. And it's in the area of behavioral health, which obviously in today's ecosystem, in today's country, and globally, behavioral health is at the forefront. Tell us why you took on this area of behavioral health with a digital platform.
Yeah, well, I mean, digital makes everything easier and better, right? And behavioral health is really, really important. Right now in the country, we know that up to 70% of primary care visits are driven by behavioral health issues. At the same time, those primary care providers are providing 80% of the psychiatric medications. So and they also say that they also have trouble referring patients for psychiatric care or for psychiatric consults. So we wanted to figure out how could we make psychiatric providers more accessible to these primary care providers, so that patients could get the care that they needed. Looking at the connections between primary care and behavioral health was, helped us identify that it's a clear waste of resources, where you have patients basically presenting for conditions and not getting the care that's needed. So our ability to use technology was first with accessibility. So meaning, could you use virtual care to make it easy for providers and patients to connect? And then the second thing is, could we use technology to track the care to help identify both the problems and then connect those patients with the best providers to meet that need?
Exactly, and we're seeing that a lot, right? So there are several other major platforms out there in behavioral health today, and actually a few of them in New York City, which is always good to see as well. And certainly in talking to you and getting to know SoHo MD further, it's clear that SoHo MD is very different. Talk to the audience and tell them, how is SoHo MD different from the other major platforms out there?
What we did with SoHo MD is we created a great corporate culture where we really focus on our ability to help the providers do their best work. We do that by providing them with a lot of administrative support, so that they can really focus on doing the clinical work and not on all the administrative work. We also created an environment where we really tried to help people really understand what their personal journey is, and then make sure that our company matches up with their personal journey, so that they're able to they find that we are the place where they can do their best work and achieve their goals. We also give people a lot of flexibility with their time. And so between all of that, people feel a sense of control and autonomy in their careers. And that's why we have a huge interest from providers in working at the company.
That's great. And talk a little bit about your journey in founding SoHo, and your background and how long it's been around, and what some of the major wins have you seen over the last few years?
So we've been around for over 11 years. Some of the biggest wins is that patients like to come back. So I think on average, patients come two to four times. With other behavioral health companies, patients come upwards of eight times on average for visits with our providers. So just the engagement with patients is much more significant. And we also see a significant drop in psychiatric symptoms with the patients who do come in for care and treatment. So it's a very efficient, effective platform.
That's incredible. And that kind of patient engagement is almost unheard of. So that's really impressive. And in terms of SoHo MD, the name, we got to hear more about the name. Everyone in New York City loves SoHo. It's a great neighborhood. Talk about where that name came from.
Well, yeah. So the company was Dr. Ratush and myself. We both had, we moved our private practices to an office in SoHo down on Prince Street, which is a very fashionable area. And it was a great location for private practice. And that was one of the inspirations for the name.
Yeah.
And also, the other inspiration was also the notion of being the art of health, that when it comes to health, there's part of it's science and part of it's the clinical experience. And that also fit as a good tagline.
That's right. And again, for those of you who are not from New York City, SoHo is also a very trendy art area. You'll find a lot of tremendous art galleries in SoHo, and it's a nice place to walk cobblestone streets, get some food and a nice bite to eat, and obviously stop into a gallery and see some art. I'm starting to sound like the Economic Chamber of Commerce or something for New York City. The passion for a startup is amazing. It takes so much time and energy. It is really. I was talking to a mom recently, and she said it's actually, having a startup is actually harder than raising a child, because at least children sleep at some point during the day, and startups never sleep. Talk about some of the energy that was needed to take SoHo MD as far as it is today.
Yeah, I think it took a lot of energy, but I think the biggest challenge was developing a team. Just like you're saying, that it's a constant effort to really develop and grow an organization. It was really finding the right members who became part of that core team, where all of us really melded well in terms of our work styles and our strengths and weaknesses. And that allowed us to really achieve what we've achieved over the years. But it's and also creating an environment where each person can contribute. So it's not about one or two people. It's literally an environment where each person can really bring their best self to work every day. And we find solutions coming from every corner of the company. We have ideas coming from everyone, both from the administrative staff and clinical staff. And having a culture that does that's really what's special. And I really enjoy working with the whole group that we've grown over the years.
Yeah, and I think the one of the things that folks outside New York City, when they hear about New York City as a digital health ecosystem, they're trying to figure out why that is. Why has New York City been so instrumental in seeing the growth of SoHo through, and how has it impacted the growth of SoHo over the last several years?
Well, the saying, if you can make it here, you can make it anywhere. There have been a lot of challenges, both dealing with the insurance companies and dealing with the cost of rent, the cost of staff. So we've expanded into 20 states, and all the lessons we learned here in New York really kind of helped set the stage for us to have that kind of growth. But there's just a huge talent pool. There are a lot of smart people in New York, and when it comes to getting access to the best and the brightest, they're here in New York. And so we definitely were able to leverage that to our advantage.
It's fantastic. And when you're based in New York City, you also see a large diversity of patients, and there's a lot of things going on like that as well. How has your personal practice translated into the development of SoHo MD? What did you bring from your personal experiences as a physician in New York City into SoHo?
It was definitely, when I finished residency, I worked with underserved populations, and before I went into private practice, and everything from working with homeless, desolate patients to really super wealthy patients, there were just patterns that were very consistent in terms of challenges that people face when it comes to behavioral health issues. And so the wide range of experiences really helped create a framework that shaped the clinical model that we use, that we're able to apply to patients to both get to the right diagnosis for patients and then get to the right treatment plan. And I didn't point that out before, but that's one thing that we really have, that as an organization we've done so well, is create a way to really accelerate understanding what's going on with you psychiatrically. So I think you see a lot of companies where they've optimized the transactional nature of getting a diagnosis and giving you a prescription, which from a business case is wonderful, because if you optimize that, you can optimize revenue and profit. But for us, we're optimizing those clinical outcomes from the get-go. It took longer for us to put it together, but then it creates a really robust system where our patients do well, as I mentioned before.
It's fantastic. And just looking through the audience from around the world, again, just so many people involved in listening to what you're talking about. We've got folks who are online from everywhere from investment firms and investors to large health plans, large hospital systems in New York City. We've got some folks from the FDA, we've got some folks from HHS, and obviously a lot of folks from academia. One of the things that you've talked about with me is about this idea of having a not-for-profit in New York City that you had found and put together a series of learnings and developmental modules for kids in New York City to get excited about computer sciences. That's your background on top of medicine. Tell me a little bit about this idea and about where it's going.
Yeah, absolutely. Healthcare it takes a huge portion of our GDP. It's going to be a significant business area where we need expertise and we need focus. And there's so many of the young patients we see, when you talk to them, there's a real focus in terms of their careers around entertainment, being a social media influencer, and sports. And so we're not preparing these kids for the future. We're not preparing them to be part of the workforce that we're going to need to help really deliver the tools and the solutions in the health tech environment. So the goal is to put together this program where we are able to take the kids who have an interest in technology and really nurture that interest, and also provide them with mental health support so that we really are preparing them for the future. And one other interesting fact is that when it comes to stress, two of the top things that cause stress are money and work. So if you have these kids and you prepare them to be able to be financially independent, working in a career that they love, and being able to provide in a sector where they should have lucrative careers, we're really helping them be set up to have great mental health and physical health. And so this is a great place to do it. We have so many companies that could really contribute to that effort. And I think it'd be great for the kids, it would be great for New York, and I think it would be great for the country.
Absolutely. And just looking at the need right now for developers and computer scientists in digital health and certainly biomedical informatics and computer engineering, it's incredible. Most of the work that's done right now to develop anything touching the digital health ecosystem is taking place offshore. And so we need to develop more of that onshore technology and certainly capital, if you will. So anyway, this is fantastic. And when you think about, we'll call it right now, just for lack of a formal name, the New York City High School Health Tech Hub. If you think about that for a minute, where would you like that to be in 10 years? What would that look like with your vision?
It would look like a franchise model where we have it in different cities, so that it really, we work with the local organizations, local companies, starting with New York, and companies that would benefit from both supporting this effort and benefit from having these kids potentially be future employees, that, working together, that we could really improve the workforces that will help all of us, each of our different companies do well by having a prepared workforce for the future and making us competitive around the world.
Fantastic. Well, thank you very much, Jacques, for joining us today. And if anyone's interested in helping out with that high school health tech hub idea, certainly get in touch with either Jacques or myself. LinkedIn's are both in the chat box there. And again, Jacques, thank you very much. It's a pleasure having you.
Yeah, thanks for having me.